Hi, everyone. Welcome to Wellness Wednesdays with me, Yehuda Shamroth. I've been a nurse anesthetist for over 30 years in the United States, and I currently am a practitioner of Chinese medicine, acupuncture, and herbology. I also do health coaching. I'm doing now the dream come true. I'm the true holistic practitioner. I advise people in an integrative method of healing, which is really the most holistic you can get. And I'm grateful for my medical background and grateful for my Chinese medicine background and putting them both together, which is the topic of today. I am known as the nurse anesthetist who does acupuncture, or the nurse that does acupuncture in the Beit Shemesh and the greater Jerusalem area. Please free to watch this live on YouTube, where you can also access all previous Wellness Wednesday webinars. Give it a thumbs up and click on the bell for notifications to see all webinars and see when new ones are coming up. And please post comments and request topics related to health, nutrition, and wellness that you would like to hear about. Every week, I like to start off with a little topic having to do with Corona, of course. I want to share my screen here and put up a slide, and we'll share. Okay. This week, I just want to mention a little bit about how long a coronavirus might live on a surface. Here's our reminder slide, which is timeless right now. It's gone on for the last year. It hasn't changed much. I usually put up a slide telling all the recommended supplements to take, which I'll put back again next week. But this week, let's just remind ourselves 5 tips for protecting ourselves and others. Wearing your mask at all times, whether you've had the vaccine or not. We know it's an airborne infection, a virus, and it can live in your nose, your nostrils, and you can sneeze it onto someone else. Even and you won't get sick, but someone else might if you're in contact with someone with active corona. Wash your hands, wash your hands, wash your hands. We know all about that, because we'll talk about in a minute that it does live on surfaces. Corona does live on surfaces, and I'm going to just tell a little bit about that in a minute. We want to eat a nutrient-dense diet, very healthy. Stay away from processed foods and sugar, alcohol, because we want to keep ourselves very, very healthy. The main thing we can do to protect ourselves and our family and our communities even at this time is to keep ourselves healthy. So try to get a lot of sleep, keep very hydrated, and stay away from processed junky foods because they don't give you any nutrients and they make you feel, they don't help your immune system. In fact, they break it down. There's a little bit of a controversy. People keep writing to me about vitamin D. I'm still a big believer that taking a lot of vitamin D helps so much, which I talked about at length last week, and I will repeat it again. But if you're interested, I'll send you the scripts to previous webinars. And make sure you eat foods that contain phytonutrients. Now, phyto is a word meaning plant in Latin, and nutrients. So they're natural chemicals that are found in plants that are antioxidant, and they fight inflammation, and they enhance your immunity. So keep up your green leafy vegetables, and quercetin we talked about last week also, which is a natural chemical that helps anti-inflammatory, big anti-inflammatory, and seen in a lot of foods, especially the red foods like red cabbage, tomatoes, red onions, cherries, apples, anything that's red. Anything that's red has these beautiful phytonutrients that we know to help enhance our immune system. So keep yourself healthy, people, and keep your hands clean. I wanted to just say a bit about the virus and how long does it stay on a surface. It's possible to catch the virus if you touch a surface or object, but a big research has been done on it recently. Of course, we've had the whole year now and many years to study viruses in general. You know that if you catch the virus, you can get it from a surface, but it's not likely to last, on the surface for more than 5. Well, it lasts for 5 days, but you have to make sure that you just keep yourself clean, and then you have really good protection. Because if you touch the surface and then wash your hands, you can use the alcohol a gel or not, but washing your hands for 20 seconds can really remove anything that's on a surface. So they did study surfaces like metal and wood and plastics and stainless steel and cardboard and aluminum and all that stuff, and they found that any paper, even ceramics, the virus can survive for up to 5 days. So, but they did see that the coronavirus doesn't seem to be spread through food. Maybe the workers, if you go for carry out dinner, you might have to worry about people handling the food, and hopefully they're wearing gloves. Coronavirus has not been found in any drinking water so far. Fabrics. Now, they haven't done enough studies on fabrics. They said they don't know how long, but it's probably not even as long as it lives on hard surfaces. But I work in an acupuncture clinic, and I use blankets on people. And so what I do is I wash them in between patients, or if I'm running short of time, I spray them with antibacterial spray and put them in the dryer for 25 minutes with some real high heat, and that kills the viruses, and that kills it as best as you can do it in between patients. And because I don't always have time to wash everything, I always clean the sheets. Of course, are always brand new for every patient, but the blankets that cover the patients, they do need to be attended to on some level. They don't know if it lasts on shoes or not, but they did see the hospital study where the coronavirus was found on shoes in China, and there was more in the ICU than anywhere else. They don't really know why. Now, what about skin and hair? There was really no research again on how long a virus can live on your skin and hair. We do know there's something called a rhinovirus, and they found that it's not really clear whether these things will. They cause colds regularly, and they do survive for a matter of hours, but they don't survive for days. But this is why, again, it's important to wash and disinfect your hands, which are most likely to come into contact with contaminated surfaces. And also, what you can do is reduce your chance of spreading the new coronavirus by cleaning and disinfecting common surfaces and objects in your homes, like countertops, tables, doorknobs, bathroom fixtures, phones, keyboards, remote controls, toilets, any handles on anything. You can use a regular household cleaner. You can buy disinfectant. You can use bleach. People are into natural products. There's some natural stuff out there that you can use. Tea tree oil. Tea tree oil is antibiotic and antibacterial, antiviral. So you can use natural oils too, essential oils that can help clean if you don't want to use the harsh bleaches and soaps. So they don't think you can get, there's a problem with using plastic grocery bags, or you don't have to wash off your food. They found it's just a little bit too much. You don't have to do that. But they do feel like if you use reusable bags, you should probably wash those off when you get home. And then one mention about coronavirus and temperature. They don't really live long in high temperatures, as I mentioned. To put things in the dryer, I spray them with a disinfectant spray, put them in the dryer if I don't have time to wash. So if there's a cool, moist place, that's where all germs live. And that's why in the operating room, we keep things either very, very, very cold, or we don't keep them hot, but we do keep them cooler. The air conditioning is really a deterrent of most of the viruses, but also heat. High heat and moist conditions can do that too. So keep your house light and airy, and clean the surfaces often. Okay, so let's go on to the topic of today. Let me get my little cursor over there, which it never wants to do on time. Okay, there we go. Okay, where East meets West. This is a topic that's very near and dear to my heart, since this is my journey and my story. And I shared it a little bit on my very, very first webinar. But I want to explain the importance of why I'm doing what I'm doing and why I feel like it's going to be the wave of the future. It's the integrative approach to your healthcare. And what does integrative mean? It means you can take the best of Eastern medicine and the best Western medicine and put them together. And there's no contradictions, and they complement each other quite nicely. For instance, if you're coming to a practitioner and you have high blood pressure or diabetes, thyroid disease, anemias, these kinds of things, of course you have to take medicines for so many of these things. You have to take cardiac medicines. You might have to take insulin. You might have to, take supplements for iron and things like this to get your anemia up. If someone comes to my office, I'd never take them off any of the medications at all. That's between you and your doctor. It's not my job to take you off your medications. Some people do want to go off their medications. They want to go off their cholesterol medicines. And I say, look, let's get you healthy. Let's get to the root cause. That's what the whole idea between that Eastern medicine is brought to the picture, brought to the forefront. They've been doing it for thousands of years, looking for the root cause of what's going on. Don't just look at the symptoms, like, you have pain in your back, you have a headache. If let's say if somebody has chronic migraines, they've been to doctors for years. They go to neurologists, they go to pain specialists, they go to everywhere. Very few people recommend that they change their diet, their lifestyle, take supplements, do Tai Chi, meditation, get acupuncture. Very few people in the medical world actually think of these things. And what you want to think about is, like, why is this person having the headaches? Why is this person? You don't just focus on the head. It's not even up in the head. It's coming from somewhere in the body, probably. And unless you had a head injury or, God forbid, an impending stroke or something like this, a brain tumor. I mean, there are things that cause headaches in the head, obviously. But we know that a lot of times digestive problems are the root cause of so many things. So poor digestion, irritable bowel syndrome, inability to absorb all your minerals and nutrients, something like that could be enough to give a person migraines. Stress in their lives, a liver that's not functioning well, spleen and stomach, and all these different organ systems. Even poor quality lungs can bring on migraines if you're not getting enough of oxygen to your brain. Poor nutrition can give you terrible migraines. So the purpose of an integrative medicine practitioner is to look at all of those organ systems to see where is the root cause behind, let's say, your headaches. I always like to use that example because it really speaks to me. I have headaches a lot. I'm getting better because I'm figuring out what's going on. Okay, here's my history, just really briefly. I went to nursing school in Buffalo, New York, and there I am on the left or the right. I guess you can see what my nursing dean is putting my nursing cap on me, which they don't even wear anymore. And just for fun, Purim is coming up. It's a Jewish holiday where we dress up in costumes. I happened to find this picture of my daughter who borrowed my dress, which I held on to because I loved it. And she used it as a Purim costume. So that's my cute daughter, Hadassah. She's wearing my dress 20 years later. What would I say, 30 years later? So she's not wearing it tomorrow, but she wore it a couple of years back. So here I was, a regular nursing student, very enthusiastic to take care of patients, and I've always been a very, very good nurse. I care about people. I am very conscientious, and because of that, I went into a different field, a more advanced field called anesthesia. You can be a nurse anesthetist in many countries in the world, especially America. And here, as I am pictured as giving anesthesia for the eye for someone who's about to have cataract surgery. And so I learned anesthesia on a higher level nursing. It's not even nursing anymore. It's somewhere in between doctors and nurses, a very high level of education and responsibility. And every time I would talk to these patients, they would say they had all kinds of chronic problems. Because I was a good nurse and I was attentive to patients, I'd say, I would notice if they were sad, or I would notice if they were rubbing their eyes, or I would notice if they were just feeling uncomfortable. I'd say, what else is going on with you? Because when we evaluate someone for surgery, you want to know, did they have something to eat or drink? And are their labs normal? And are their chest x-ray normal? And do they have someone taking them home? And do they have any reactions to drugs? There's a lot of questions we ask, but I would go further and say, how's your emotional health? Are you feeling okay? You seem sad. And I would be the person that would find out a person maybe just had a death in the family or something. Or I would be the person to find out that they have a chronic illness and that was not being addressed. And I'd say, irritable bowel, difficulty sleeping, fibromyalgia, migraine headaches, dry eye syndrome, all these things that are really debilitating, autoimmune diseases and stuff. And I'd say to so many patients, I'd say, well, what does your doctor tell you to do about these things? And nothing to do with the surgery, obviously, just this conversation. And I would say 100% of them would say to me, the doctor told me to go home and live with it. And it used to break my heart and think, that's wrong. This is so wrong. Well, we're failing our people here. We're failing our patients in the traditional Western medicine world by not offering them solutions of other kinds of healing. And I didn't even know what they were, truthfully. I was never an earth mother. I was never into making baby food for my kids by organic food or any of this stuff. But I decided to do research. And in doing my research, I found that there were so many healing modalities out there that have nothing to do with medicine and surgery and medicine, which is pretty much what we offer from the Western standpoint. So I felt like I could be a better practitioner and take care of people so much better if I'd learned traditional Chinese medicine and incorporated it into my care of people. So that's what I did. So now, this is what I'm doing now. It's me standing, and I'm giving acupuncture at a health fair right there. So now I've progressed. I feel like it's been an evolution for me. It's been an amazing journey. I wish I would have done it 20 years ago, but this is how it happened to me. I only discovered it when I was 50 years old, and now I'm 63. My birthday's next week. I'm still going strong, still learning all the time and trying to be a better practitioner for people and being the best nurse and the best caretaker that I can be. And that means to be an integrative medicine practitioner. So what does it mean for East to meet West? Okay, I've discussed it a little bit, but I can tell you a lot of people feel like me right now. The landscape of medicine in the United States has been slowly progressing towards a more holistic and individualized approach to healing. So part of this progress has been the integration of the Western and alternative forms of medicine, as I mentioned. A concept that has been described as integrative, because it also is called there are a couple other names for it. I'll come down to it. Conventional versus alternative. There's a lot of different ways to describe. The approach to healthcare incorporates a patient's mind, spirituality, sense of community into the healing process. Integrative medicine has been typically well received, and the demand has actually been very steadily increasing, especially in the United States and Israel and Europe. So a lot of this, I heard recently that it wouldn't have changed very much. It was Dr. Andrew Weil who said this wouldn't have changed for the positive for us if it hadn't been for consumer demands. So you should know consumer demands got you, they're getting us better care. So the whole idea of finding out if someone's what the root causes of their illness is to see if they're in balance or not. And this is the holistic approach again. So very simply, traditional Chinese medicine practitioners believe that a healthy body is a body in balance. So within the body are two opposing forces, which I'm going to give another class on yin and yang and how they should be equal. And you can't have one without the other, and the importance of vital flow of energy, which they can call qi or whatever they want to call life force. But when we have an illness, when we have pain, when we have something wrong, that means the body's out of balance. It's very logical. And so we get to the root cause of it and try to release the pain, there are things called blockages too in Chinese medicine. And it's very logical. If you know enough about Western medicine and Eastern medicine, you know there are no contradictions. So if you can imagine that your shoulder hurts really severely, the regular medical community, Western medicine says, let's focus on the shoulder and let's give you some medicines to take, some narcotic or some non-steroidal anti-inflammatories, or they might even inject. And the alternative, people say, look, they also want to focus on that shoulder, but let's get the body in better overall health. And pain in Chinese medicine is due to a blockage. And just it makes sense. They go together. It's got to be a blockage of blood flow, nervous system flow, energy flow, whatever's going on. Acupuncture in Chinese medicine and herbal medicine in particular can help unblock these blockages and relieve the pain. So this is very important to have access to and very important to offer people. So I want to talk about just the difference a little bit. That's what I talked about, balance. I'm listing my slides. I love this picture. It's just beautiful. Okay, the difference between conventional versus alternative medicine. Okay, so there's a concept called reductionism. Reductionism is breaking things down to its finer components and finding one cause or one problem and coming up with a cure for that one cause and one problem. So it is very, very helpful because we wouldn't discover all of our medications and wonderful cardiac medications and emergency medications, antibiotics, if we didn't break things down to their essence and see what can help this one virus. Let's look at the coronavirus. They want to come up with a vaccine, and I'm not going into any kind of vaccine discussion, but they're going to gear it specifically toward this. So this is a really good thing. It's very logical. They go through this checklist of, is this wrong? Is that wrong? Is this good? Is that good? It's very linear. Okay. This is conventional medicine. They look at the timeline and they want to see how you're progressing over time. Come back in 6 months. Don't you hear that a lot? Come back in 6 months. Tell me how you're doing. You take an acne medication, antibiotic, and come back in 6 months. If you're going to have some kind of therapy, come back in 6 months or even a month, depending on what your problem is. But they want to check you on a linear, like on the calendar. They're looking to fix just one cause. Okay, just one cause, and they're going to fix it up for you. And a surgery, they're going to fix you with surgery. They're going to fix you with procedures. And I'm not against this. I've done this all my life. I really believe in Western medicine. I've been giving anesthesia for over 30 years, and I really functioned this way. And I felt it was very, very beneficial. Again, knowing that something was missing all along. So now let's look over at the alternative side. It's more holistic. It looks at the whole entire person. They want to know if you're sleeping well. They want to know if you have good family relationships. We want to know what your diet is like. We want to know what kind of stress is going on in your life. We want to know if you've had any past traumas. We want to know if there's we want to know what you were like. Let's say we have a woman walk in who's in her 60s like me or 70s, and we want to know all about your menstrual history. Why? I mean, you don't have it anymore. You're in menopause. Well, sometimes if you have a difficult menstrual history, we can give us as an insight into what's going on now. How did you get to where you are now? We can look at the patterns that are developing. Chinese medicine talks about patterns. And usually fall into two categories of excess or deficiency. And that helps us narrow down to what organ system. We look at other things too, which I'll go over later. And it's a more of a subtle kind of way of examining somebody and also subtle changes. So where conventional medicine, we can give you a pill and we can do a surgery and fix you up right now and you'll be healed soon. Alternative medicine takes longer. You have to be very, very patient with it, but it's healing. It actually is healing you, but it takes a lot longer and involves commitment on the part of the patient and lifestyle changes. But there are fewer side effects as well. And one thing that people would notice about alternative medicine is that that the treatments are really not really very well understood. And this is one of the reasons why Western medicine hasn't really been so enthusiastic to grab onto it, because it's that we don't really know. I mean, we do know now. There's a lot of research being done, but how did the Chinese have it so successful in curing people all these years? It wasn't by accident. They really had a true medicine, but they didn't do any kind of studies. You know, the kind of studies that the medical people, scientific studies that they want to know, double blind and all this other stuff. They're doing those now, but it says here on my slide, why do they call it alternative medicine when it's the original medicine that humans have been using for so many thousands of years? And chemical medications were discovered about 100 years ago. Okay, they're discovered in plants, by the way. We used to use plants and herbal medicines way before we had manufacturing centers to big pharmaceutical companies and things. So, but we do know these treatments are becoming more and more understood, and we're trying to educate the medical community and the regular population as well. But we do know that for acupuncture, for instance, which is what I do, we know it has to do with mapping the nervous system. But Western medicine tends to reject it because they just don't understand how you can map the body. And they look at the energy channels they call meridians, and they think, how can you do science, or how can you put a needle somewhere where you don't even know, you can't see this meridian, it's invisible. Energy medicine is something that's also very misunderstood, but we know everything in the body is electric. We have EKGs that give us an electric reading of the heartbeats. We have EEG, electroencephalogram, which gives us reading of all the chemical or the electrical activity of the brain. And we know we have electrical chemical reactions going on a very minute level, on the cellular level. We're the body electric, that we are. I've said this before. And people want to call, let's say, results. We get great results with acupuncture and Chinese medicine, along with the Western stuff. If you need a surgery, I'll tell people, let's say a knee surgery. People need knee surgery. So I say, go get your x-rays and go get your MRIs, and let's see what we're dealing with. Somebody wants to help me to help them with knee pain. They may still need knee surgery. Maybe the bone is really rubbing on the bone and they need that knee surgery. But in the meantime, I can make their pain more comfortable, and I can, and even acupuncture can stimulate it's a brain treatment. Wherever we put the needle in the body, doesn't matter. We learn it and we know where to put it. It's an instantaneous message to the brain to say, let's heal this body, because the body wants to heal itself. And to a very large degree, we can heal a lot of things in our body if we get back down to basics, if we get back down to what we talked about, maintaining a really healthy lifestyle, eating healthy foods, keeping hydrated, being very rested, minimizing the stress. That's the lifestyle changes people have to make on their own. And then the acupuncture and the Chinese medicine and the regular medicine can function so much better together. You still might need that knee surgery, okay? But I can help you with the pain, and I can help you with the inflammation. I can help you with the swelling. And sometimes I've seen many cases, not my own recently, but people have told me that they have prevented people from having surgery at all. Acupuncture sends neurotransmitters all over the body to say, get that healing underway. Okay, we don't understand the brain no matter how much we've studied it, but we do know the brain is controlling everything. And they want to call it the placebo effect, let's say. Okay, you've heard about the placebo effect. That means maybe the patient's imagining it. Maybe they want it so badly. They want it so badly that they feel better. Well, I don't really buy that, because people cannot, I believe in mind over matter, that's for sure. But because there are people that come with the opposite view too. They come, you'll never be able to help me, and nobody ever will. And people, they do buy into their own sabotage thinking, and you can reverse it too, and you can will yourself well too, to a certain degree. But the placebo effect does work. It does make us better, and it gives. They've done studies on placebo. It gives 30% response for effectiveness, and we know that there's some medications out there on the market with way lower responsive rates of effectiveness. So we don't really fully understand how that helps either, but it does help. Okay, so alternative medicine combined with conventional medicine is called integrative medicine. And this should be and is going to be the new healthcare model. And people used to say it's too expensive, but now they're seeing with people doing much more of healing with a lot of these practices, which I'll go over what they are. They're actually going to save money in the long run and save time in hospitalizations, because if you have a patient who's getting acupuncture and they don't need to keep running to the hospital for even lung problems. I mean, it's not just for pain. Acupuncture helps people strengthen every single organ system. I'm doing a lot of treatments now post-corona for people who want to get their energy back and build up their immunity again. And I'm keeping people out of the hospital. I'm convinced of it. And with my herbal medicines also, and also people who are having some bad reactions to the vaccines, which they've been having for many years, by the way. This is not the only vaccines where people get fevers and they feel sick and they feel tired. And babies, we know when they get their immunizations, we always know the babies are going to be cranky for the next 24 hours, and they'll have a fever and they're going to be sore. And, So we know that this is always a side effect for some people. Well, I can help clear that out of your system by doing cupping on your back and doing giving an herbal formula that clears toxins out of your system. This is a great way to continue the healing or to create a healing that you can't get but with any medicines or any hospital visits. Okay, so let's talk about integrative medicine briefly. So it's the art and science of healing that addresses the care of the whole person, the mind, body, spirit. And again, we mentioned a few times, combines conventional and complementary therapies to promote optimal health and prevent and treat disease by contributing factors. And also preventative, which is an amazing thing. I tell lots of stories about how Western medical people really miss the boat on prevention. We talk all the time about preventative medicine, and yet I see a lot of missed opportunities to counsel people on diet and nutrition, to counsel people on drug and alcohol addictions, to counsel people on taking their medications regularly. I mean, there are nurses that do that kind of thing, which is wonderful. And my mother had a wonderful nurse practitioner in her office who helped her with that kind of stuff. Doctors are really busy. They don't have time for that. It usually falls on the nurses. But if people don't have the good fortune of having a great medical doctor with a good nurse practitioner to go to, they don't actually get this information. And it's very unfortunate because so much could be prevented. We talked earlier in one episode about how obesity contributes to so many terrible things, and you just lose a little weight and your body says thank you so much. Your heart says thank you so much. Sleep better, blood circulation better, everyththing. Okay, so we've talked at length about the integrative medicine. I'm not going to read all this. I had a lot of good stuff. I look for my studies to come from Johns Hopkins and Duke University, because of course I came from Baltimore for Johns Hopkins and on went to my anesthesia training at Duke University. So a lot of my studies, my favorite studies to look at, are from those two places. So the research shows the efficacy and are prevalent and important guide of treatment. So you have to know that they're caring a lot about offering alternative medicine that is backed up by studies. So this is what I'm trying to say, is that nowadays, because of the demand for what they call evidence-based medicine and all kinds of studies, this is happening quite regularly at most of the big universities. So you can rest assured that people in the big places, when they have the Department of Integrative Medicine, which is already a big win, Duke University has one, Johns Hopkins has one, University of Maryland, and all the universities all over the country, and all the hospitals all over the country that are big universities will already have a Department of Integrative Health. So we know it's a very distinct approach. It's holistic. And I want to see if there's anything really. It's approach to care that puts the patient right at the center. And it addresses the full range of physical, emotional, mental, social, and spiritual and environmental influences that will affect a person's health. And so then you come up with a strategy to help them with their own unique conditions. So it's not just, I used to work in the operating room. We'd have a whole day. I'd be assigned in the room where we would do hysterectomies on everybody. That would be my room. I'd be working with the OBGYN doctors. That's how I met my husband, in the operating room. He was doing the surgery. I was doing the anesthesia. Anyway, so we would do 5 or 6 people who were having hysterectomies. And, hysterectomy. And everybody was different, but they did the same procedure on everybody. And I could see that patients weren't getting such individualized care. And it wasn't anything they even noticed. It was pretty subtle, but I felt kind of bad. So this is one reason I would always focus on people a little bit more emotionally. But in addition to giving very good anesthesia, I hope, I never hurt anybody in my 35 years of work. But because everybody has unique conditions and circumstances. But and actually anesthesia was a good training ground for that, because even though I could do 5 anesthesia for 5 hysterectomies in a row, everybody was a different age. They were different weight. They were different size. They had different allergies. They had different needs. So for me, I already learned to tailor my care to people with anesthesia. That would be the surgery, not so much, but the anesthesia has always been having to be tailor-made. You have to. Okay, so this is going to be the World Health Organization defines integrative medicine as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, which I think is great. So we don't want to say, oh, I'm a healthy person because I'm not sick. You want to say, I'm a healthy person because I created that healthy body, and then my doctor helped me with integrative medicine, or my nurse practitioner, or my nurse anesthetist like me. Okay, so we want to restore the health and maintain wellness across the person's whole lifespan. Okay, so there are defining principles. Okay, I don't have this up here, but these are the conventional healthcare workers, which we're all familiar with: medical doctor, nurse, physical therapist, personal trainer, maybe weight loss management coach, psychologist, and social worker, which are all really great, and we can't live without them. We need them. So let's put it together now with complementary complementary or alternative practitioners, acupuncturist, massage therapy, neuropath, osteopath doctors, chiropractor, craniosacral reflexology, energy healing, Reiki, breathing techniques. I have a patient right now who said that I didn't help him with his high blood pressure. It was his breathing techniques that did it. And I said, okay, fine. Whatever it is, I'm glad your blood pressure's down now. And he was going sky high, and he's a healthy guy. He runs every day. He's thin. He's in his 60s. He doesn't eat any fat. He's been watching his diet for years. Well, between the acupuncture, his herbal medicines, and his breathing techniques, his blood pressure is now under control and doing fantastic. Traditional Chinese medicine, which is TCM, herbal medicine, meditation, biofeedback, hypnosis, art, dance, and it's an endless list of all kinds of things. There's animal therapies, there's all kinds of things that can help people become well. Okay, so there. I'm going to read the defining principles of integrative medicine. Okay, the patient and the practitioner are partners in the healing process also, which is another little bit of a difference. I don't want to talk negatively about Western medicine, but normally I'm the doctor and you're not, or I'm the nurse and you're not. We see this. That's not nice. It's embarrassing. I hate to hear these stories, but it does happen. So you want to go to somebody who's going to include you as part of the care and really care about what you think and include you in part of the healing process. All factors that influence health, wellness, and disease are taken into consideration, including body, mind, spirit, and community. Providers use all healing sciences to facilitate the body's innate healing response. So you want to see what the patient actually is going to be okay with as well. If you put a person on a strict diet and they're not going to stay on it, it's not going to work. You have to work with them and see what they agree to and get the response, and go slowly sometimes. And that's why it is a little bit longer of a healing. Effective interventions are natural and less invasive. Except for acupuncture. Good medicine is based on good science. So it's we want to know, as we mentioned a lot about it, we do a lot more studies on it now. Alongside the concept of treatment, the broader concepts of health promotion and prevention of illness are paramount. And the care is personalized to best address the individual's unique conditions, needs, and circumstances. Practitioners of integrative medicine exemplify its principles and commit themselves to self-exploration and self-development. Now, this comes from a study from Duke University for their Department of Integrative Medicine. So the benefits now are, of course, I think obvious to me, but the benefits are, look, I'm going to just read a couple of things because I find it very interesting. I'm going to go over at the end a couple of examples of how successful it can be to combine the two things. But a large hospital in California did a big study in their clinic. Their cancer patients involved in the study they did were studied for, they were going to go through a breast mastectomies, and they had much more improvement in their appetite, fatigue, cognitive and emotional functioning, pain, anxiety, sleep, and overall global health because of the benefits of alternative medicines and also alternative treatments like acupuncture, massage, and Reiki, and all those different things that I mentioned. So it says cancer is not the only disease where integrative medicine has been successful, which I'll talk about later. So we know that we can really help people who go through chronic things, especially, but even instantaneous things. People come to me with back pain. Just happened yesterday. We cover all those areas very successfully. I do see some immediate results too. I want to talk about that because I think I didn't make it so clear that you can also get some immediate results with conservative medicine. Oh, I wanted to talk about the evaluation is very similar to a medical evaluation. It's medical history. I want to know everything about you medically, past surgical history, all your medications, blood tests, other studies, scans if they're appropriate. And then there's a detailed neurological evaluation, psychosocial evaluation, dietary history, menstrual history, sleep patterns, tongue diagnosis, and pulse diagnosis, which I will explain. So there's a lot more involved. And I feel like I wished I would have done this more when I was regular nursing and in regular anesthesia care, because I felt like we didn't have enough time to spend with every person and to find out a lot about them. And to get them to true healing, you don't just want to take their uterus out or fix their knee. You want to really heal the whole person. This person's going to come back again with another problem if they don't get their health in order right away. This is what my form looks like. It's not so clear, but there's pictures of lines up and down the body that represent the energy channels. And the energy channels are named by the organs in the body by the Chinese. And they're connected to the internal organs, and we access them from the outside. So if I want to treat somebody with stomach problems, there's a stomach channel that I can go to on the leg or the arm or the face or wherever, and I can help strengthen their digestive system, and if that's their root cause. And so we know where they are. And over here on the right are the same questions you get in any doctor's office. Do you have allergies? Do you have asthma? Do you have bronchitis? Do you have adrenal weakness? Do you have abdominal pain? Do you have headaches? All these things are on there, but they're grouped a little bit differently for Chinese medicine. And I'm going to give a class on that one day and why we do that. It's very, very fascinating how the Chinese have grouped certain organ systems together. And the Chinese, of course, observed nature. So they had nothing else to really observe. They didn't know they have studies going on scientifically 2,000 years ago, but they observed how people responded to the winter, spring, summer, fall, and how different people were more like one season or another. People were more like a wood season, like a spring, or some people were more fiery, like like summer, or more calm and collected with like the water, like the spring. So this is how they envisioned people were healing too. You look at kind of person that has their constitution and how strong it is, and what their nature is. They're like nature. Nature is like them. So a lot of the treatments are based on observation of nature. I mentioned tongue diagnosis. It's an interesting thing. We look at the tongue for size, shape, and color. It gives us a little insight of what's going on internally, oddly enough. And just like you can superimpose the whole body on any, like reflexology on your hand, the back of your hand is the back of the body, and the front of the hand is the front of the body. And a reflexologist will massage on your foot or your hand, and they can help you stimulate healing in a certain part of the body, again, through the nervous system to the brain. So the body can also be superimposed on the tongue. And so actually the tip of the tongue is the upper body, and the whole middle of the, let me see if I can do that. The whole middle of the tongue represents all the digestive processes in the liver and the gallbladder. And the back of the tongue, way in the back, represents your lower body with your kidney and your small intestine, large intestine, reproductive organs. And so what we look for is, are there cracks there? Are there thick coating? Are there whiteness? Are there pieces of tongue missing? You can't believe people have, they call patchy tongues. People have puffiness all over. And again, it's color, let's say an example of color. If it was a white, very thick, floppy tongue that's kind of pale looking, the person, it's not rocket science. It's very logical. Patient is probably anemic and probably has no energy for anything. And if somebody has a big, thick coating in the lower part of the body, these are the people that usually have digestive problems, lower digestive, or they might have bad periods, or they might have back pain. And that means that thick coating that looks like a bit of a mayonnaise or something actually represents that the circulation of fluids is really uneven in the lower body. And so we see it's a little reflection of what's going on. The liver sides, sometimes people are very, very puffy. I'll show you some examples of tongues. They're kind of gross, but they're interesting. If it's very, very red, like in the bottom right, that tells us, of course, the person has a lot of heat in their body. They might not even feel hot, but let's say they're really dehydrated and they're getting these headaches because they're so dehydrated. And look at how red that tongue is. Up at the top, the person can have, this is a terrible digestive situation. The person who is a very unusually, the bottom and the second to the left, this person has probably cancer or something very serious wrong with them. Their tongue is just all shriveled up, and you can't even tell what's going on with it because it's just, there's nothing normal going on with that digestion or nervous system or anything. And this, I think the bottom left is somebody who probably smokes. And you can see the different shapes too. There's some are very, very long and thin. That's a sort of a nervous person. Another thing on my form that I forgot to point out that we look at people's emotions too. Emotions are ascribed to the body parts, and the body parts are ascribed to emotions. So let's say in Chinese medicine, we'll talk about it in another class. If you have a propensity or you feel like you have a natural tendency to anger, there's usually some liver issues going on. And the reverse is true too. If you have liver issues going on, you drink too much, or you have some kind of fatty liver or something, it leads you to be an angry person. And that's true. That's true in Western medicine. It's true in Eastern medicine, by the way. Like again, there's no contradictions if you understand both. Okay, we take a pulse. The pulse tells us it's not just your regular pulse. We like to see the quality of pulse, just like in Western medicine, to see if it's fast or slow, if it's regular or irregular. But there's all different divisions of the Chinese pulses, and they're ascribed to different parts of the body. So if you put your finger in one place and it's weak, and that happens to be the stomach area, then you can tell a little bit of insight. There might be some weakness in the stomach area of a person's body. And again, all these things are put together to give us the best indication of what is the root cause of their illness that they're coming for. So the alternatives out there that we can incorporate with our medicines and our surgery or not, depending on what the patient needs: acupuncture, Chinese herbs, massage, and you've heard of all these things. I particularly do acupuncture, and I'm studying all the time. I'm always trying to get better at it, always getting, taking more courses, and I've been trained very well. But I really believe in acupuncture because it releases blockages and it tells the nervous system to calm down or to rev up whatever it is necessary. Send out those neurotransmitters to help with pain, to help unblock a stuck blood flow or stuck emotions. It does so much. And again, this is a very basic indication of a description of what they call Chinese medicine meridians, or patterns of energy flow that go to the organs. And I had somebody, I won't say who, but I come from a medical family, and they say, "Oh, that's such." Believe in your alternative, your acupuncture meridians when you show me an alternative. Well, that's not right. I'm going to repeat that later. You can't see these meridians. Okay, they're all energy channels, but we find out with research now that they are all along the body, along with the nervous system. So that makes so much sense because they've done studies now with all kinds of sophisticated equipment that can see. Let's say if you put a needle right here, this is a very popular point. Where am I? Really popular point called large intestine 4. Helps the large intestine. It's also a command point for the head. It helps with headaches. Now that if you put your sophisticated tools there, they see there's like a real well of all kinds of energy there that can be released and sent out to the system to help the healing of the head or the back or wherever you're trying to treat. So because you can't see these meridians in a dissection, a lot of the Western people don't believe in them, but they're there. They really are there. Okay, how does acupuncture work? It strengthens the immune system. It stimulates endorphins, natural painkillers, up to 10 times stronger than morphine. It affects the neurotransmitters, helps the body cope with stress, depression, mood disorders. It helps regulate the circulation. It can regulate hormones and so much more. You can see on the right here, these are the things that people come to me for, and I can help them with acupuncture, chronic and acute conditions, including but not limited to depression, anxiety, insomnia, low back pain, high blood pressure, migraines, allergies, digestions, fertility support, and more. And by the way, this is a list of what I see just about more regularly than anything. This entire list I see all the time. Something or a combination of these, unfortunately. There's something called cupping. I'll describe that another time, but it helps release the tension in the tissues, and the physical therapists use it as well, and helps the blood flow of an area that's uncomfortable, and it helps with if you pull up into the cup a little bit of the tissue, you pull up anything that might be stuck or stagnant there. We keep stuff in our tissues by breathing smoke in the air, by eating processed foods, by having chemicals in some of the foods, by breathing the pollution in the air. It gets stuck in our tissues, and it's a good detox too. A little bit of a detox. This is what I do on people who have had the vaccine. By the way, I will do this on their back, and I will release, pull out of the tissues a lot of the stuff that's causing them agony and pain, and then it gets taken away by the lymphatic system very much more efficiently. And massage, of course, feels very, very good to everybody because once you get that blood moving, it brings fresh oxygen in the place, and the body is saying thank you for that fresh oxygen. That's why massage feels great, because you're moving it, you're encouraging the blood to flow better, and the oxygen makes the tissues feel great. Okay, so I'm not going to we can do a whole lecture on this, but are you going to take herbs or pills? People don't know a lot about herbs, and that people think they don't have access to them. They don't understand them. They think they're dangerous. I have so many patients that a doctor say, don't come to me if you're on herbs, which I can't believe. Now herbs are like medications. They can heal you, and they do have their side effects. So we have to be very, very careful about what we give everybody. Of course, that's why we make an individualized formula. But these plants have been around for thousands of years, and they've been known to really be helpful and healing in so many ways. And I'm going to go through them in another time. But we know that people are very popular. Let's take digestive for an example. When people have a digestive issue, don't you take some ginger, and that helps you? Like all your kitchen herbs can even help you. They're called they're kitchen foods, but they're really herbs, and they're really medicines. They're medicinal. Ginger and peppermint and anise and those kinds of things help calm the stomach digestion down. If you're like feeling a little nausea, or ladies who are pregnant, or people who just ate too much food and they're too full, they can take these kind of things. Ginger and mints and all these things help the digestive system calm down. And so that's an example of herbal medicine. Okay, and going to be a whole class on it, which is a lot of fun because it's so much fun to learn about it. And again, this is not a great picture, but there's basil and sage and thyme. We use them in cooking, but they all have medicinal properties. Okay, the last slide here, and then we're all finished just about. I don't know if you can see this very well, but there's a choice this man is trying to make to go to the hospital on the left or going to the alternative route, which includes an herbalist, a homeopath, an osteopath, acupuncture, reflexology. So, it's your choice and how you want to be healed. I personally am so thrilled to finally be um, tuned in and turned on to the world of integrative medicine. And again, I really wish I would have been doing this all these years, but I'm doing it now for the last 10 years. And I hope I'm taking good care of people and I'm seeing results. And again, I don't take them off their medications. I insist that they be evaluated. I had a woman who brought just one more example. A little boy, he's had diarrhea all his life. Like, okay, he was 7. I said, all his life? I said, what do the doctors say? There's nothing they can really do. I said, well, did you really get a good evaluation? Did you go to a good gastrointestinal doctor? And you have to see what's going on with him. Or maybe he has parasites, or maybe he has some very bad inflammation going on. And she really never took him. She said a lot of kids, and she was too busy, and she never had a chance to take him to the doctor. So she went to the doctor. They did a colonoscopy on this poor kid and they put him to sleep and they didn't find anything wrong except for inflammation. So then I could say, fine, you don't have any serious problems. I can take care of this child. Gave him an acupuncture and put him on a great herbal formula. It took 3 or 4 months and he's doing fantastic now. No more diarrhea. But that's not normal too. Another thing, people live with a problem and they think it's normal because they've had it for so long. So you don't need to live with a problem. You don't. So you can you can call me anytime. I'll be glad to talk to you for free on the phone to help you discuss what you might be able to do as an option for healing. This is my information. And thank you for joining me today. I will have a guest next week, hopefully. And we wish everybody a happy Purim who's celebrating and a happy, healthy week. And thank you so much for joining. And just look into your integrative medicine and demand it. You have the right to have every bit of healthcare out there that should be available to you. Okay, take care, everybody.